Good
Good
morning
morning,
and
and
thank
thank
you
you
all
all
for
for
attending. I'm
attending.
Heather Jackson, the Senior PIO for Riverside University Health System. We understand here that this is unprecedented times where we're entering a flu season that coincides with the COVID-19 pandemic. We also understand that there's some fear, some anxiety, and of course, a lot of questions. So to help the community navigate this flu season amidst a pandemic, we have several speakers from our system, from our pharmacy, from behavioral health, a physician from our hospital, as well as someone from public health to give you guys all of the information that you need to prepare for this new flu season. But before we begin, I would like to welcome the Riverside County Board of Supervisors Chairman, V. Manuel Perez, with some opening remarks.
Thank you. Good morning, everyone. And I want to just once again thank everyone for joining us. My name is Victor Manuel Perez, and I am Riverside County Board Chair and Supervisor for the 4th District. And so we wanted to organize this press conference as we enter the seasonal flu period. And it's more important this year because the flu season arrives while we still have a coronavirus pandemic out there. Fortunately, there is a step we can all take for our health and for the public health of everyone, and that's making sure that we get our flu shot. And as a matter of fact, interestingly enough, I actually got my flu shot just yesterday at our Indio clinic. And the flu shot is very important, and it can reduce our chances of catching the flu and as well as spreading it. It helps us avoid the serious complications that come with the flu. It is also a way we can help our hospital system and avoid overwhelming our stretched hospitals and healthcare workers, especially right now. It's easy. It makes the flu mostly avoidable and keeps us as healthy as possible. And on a personal note, as I mentioned, I had the chance of getting a free flu shot yesterday. So today we are starting a community campaign around getting the flu shot as a preventive and proactive measure to protect yourself and your family, and a way of helping our hospital system and our communities overall. We will hear from our county public health team on where you can get your flu shots. And I'm excited to kick off our flu preparations. And I'd like to turn this over to Dr. Cameron Kaiser, Riverside County Public Health Officer. Thank you.
Thank you, Chairman Perez. Good morning. I'm Dr. Cameron Kaiser, the Public Health Officer for the county.
Thank you so much, Chairman Perez. We're now going to turn over to Dr. Kaiser. Dr. Kaiser is from the Department of Public Health within Riverside University Health System. He'll give us an update on the coronavirus cases within the county and what to expect as we go into the flu season. Dr. Kaiser?
Good morning and thank you. I'm Dr. Cameron Kaiser, Public Health Officer for the County of Riverside. COVID-19 may have dominated the headlines, but while social distancing and facial coverings turn out to work for other communicable diseases as well, that doesn't mean we can just forget about the flu. And while COVID-19 is clearly more dangerous than influenza, influenza still kills, as was the case with our first death this flu season, a man in his 80s in the San Jacinto Valley. While we had 8 deaths this last flu season and 9 before that, keep in mind those numbers are deceptively small because the state only mandates the reporting of certain age ranges. And even for survivors, flu can land you in the hospital as well. But unlike COVID-19, we have a vaccine for the flu every year right now, and just about everyone 6 months of age and up can get it. And this will be particularly important as we look towards the possibility this fall of influenza and COVID-19 hitting our hospitals in Riverside County at the same time. And we already saw during July and August that COVID-19 alone can really strain our ICUs and healthcare workers if there's a lot of community spread. We already know from years of experience that flu isn't any different in that regard, and fortunately we have more tools to prevent it. Plus, keep in mind that percentage number you hear every year for the flu shot. We call it the vaccine effectiveness, and it's a very simple number to understand. It says how much your chances of getting the flu decrease when you get the shot. Let's take a really lousy year for the flu vaccine where it turns out the vaccine effectiveness might be as low as 10%. Even with a vaccine that badly matched, that still means a real-world 10% reduction in your chances of getting the flu just by getting the shot. And most years, we're talking numbers several times that, even in years where the vaccine is less effective than other ones. That protects you and your family, that keeps it from spreading, that keeps you working, and most of all, that keeps you healthy. Every year, but this year in particular, we need to take the necessary steps to protect ourselves. Unfortunately, what works and has been working for COVID-19 works for the flu. Wear a facial covering, maintain social distance, don't work or hang around sick people. We don't want another July or August hospital surge this fall, especially when disease spread for both really is preventable. And we don't want to see more deaths from COVID-19 or influenza. I want to thank each and every county resident for all your hard work in getting our COVID-19 case numbers down. And if we can do the same going into the winter and fall, and we all get our flu shots soon, hopefully we will have a mild season of both, and that will finally be some good news for a change. With that, Ms. Jackson, I'll hand it back over to you.
Thank you, Dr. Kaiser. I would like to now introduce Dr. Ronald McCoy. He's a physician here at RUHS. He'll be able to tell the community how they can tell the difference between flu and COVID symptoms, why it's important to get a flu shot this season, and he has a special message for the African American community that was hit terribly hard during this COVID season. Dr. McCoy.
Thank you, Heather. Good morning. Some of the symptoms that you might see with the flu include fatigue, fever, chest congestion with cough, muscle aches, and you just feel pretty crummy. These symptoms may progress to the point where complications occur, such as bronchitis, pneumonia. In some cases, there may be ear infections and dehydration. Some of the reasons that you should seek medical attention would be if you have a sudden onset of dizziness, if there's some confusion, if you have chest or abdominal pressure or pain, or if there's a sudden loss of consciousness or a profound dizziness, as well as vomiting. In those cases, you should seek medical attention. If there is a concern about COVID, one of the things that we would see in this setting would be a greater incidence of loss of smell and taste, and more significant shortness of breath compared to the flu. How or what can we do to reduce our chances of getting the flu? And in this season, I think more so than those in past, we've been wearing masks, and we still strongly urge you to wear a mask. It is helpful also as far as the flu is concerned. Certainly you want to avoid large crowds, adhere to social distancing, keeping a 6-foot distance between you and another individual, and washing of hands is very, very important as well. You can certainly go to the CDC site on the internet and get further information. As far as other things that come to mind, you want to make sure that your immune system is optimized. And some of the well-known and frequently discussed things that you can do, certainly you want to get enough rest. You want to eat a balanced diet with plenty of fruits and vegetables. You want to get exercise. You want to get enough rest. And certainly 6 to 8 glasses of water per day. Those things are well known and still remain very, very important. In this season, we encourage everyone to get a flu shot and to get the flu shot early. Flu shots are not associated with any significant complications. They're effective. You can get a flu shot in quite a few different places, certainly pharmacies, the doctor's offices, the public health centers in your region, certainly Vons, Ralph's, Albertsons, plenty of places. If you got insurance coverage, you should not have to be worried about a copay. And we particularly encourage those in the African American community. About 40% of African Americans get a flu shot, and we need to increase this number significantly. If you've got a comorbidity such as hypertension, diabetes, COPD, kidney or liver failure, then it's increasingly important that you get a flu shot, because these comorbidities could lead to poor outcomes with the flu. And so we want to strongly urge you at this particular time to go ahead and get that flu shot, take care of yourself, and take care of your family. Thank you. Heather?
Thank you, Dr. McCoy. I know throughout the season you guys are going to hear a lot about getting your flu shot, including from the message today. But we have a pharmacist here from RUHS who can talk through what the flu shot looks like this year and what to expect and how to prepare. Dr. Andy Williams.
Thank you so much, Heather, and thank you for having me here today. I'm really excited to be able to talk to you guys. My name is Dr. Andy Williams. I'm one of the senior clinical pharmacists here at RUHS. And as a pharmacist, I'm really passionate about making sure that everyone's well aware of the medications and the vaccines that we would like for you to take for your own health and your own benefit. And so my goal today is just to go over some of the common questions and concerns and some of the logistical issues associated with the flu vaccine. So first things first, what is this flu vaccine? What are we offering? Well, this year we have a quadrivalent vaccine, which is typically what we've been using in years past. And what that means is this vaccine has strains of 4 different types of flu virus that are the most commonly encountered that we predict will also be the common strains circulating this season. And by taking this quadrivalent vaccine, we could try to boost our immunity against those viruses if we were to encounter them. Typically, how they come up with what formula they're going to use in the vaccine, they look at past trends, they look at flu seasons from other parts of the world, and see if that's going to be mirrored in our region here in the United States. And so it's very common now that we are using these vaccines that will be able to protect you against 4 different strains of the influenza, mainly influenza A and influenza B. With that, many people are candidates to receive this vaccine. It's indicated or recommended all the way down to 6 months of age and higher. So it's one of those medications or vaccines that we want more and more people to have access to be able to take it to help protect themselves, to build their immunity. As was mentioned, they're very well tolerated. There's very little side effects associated with this. Yes, it may poke a little bit, may hurt a little bit with that first little prick, but just think of what would be entailed if you were to be diagnosed with influenza. You'd have days or weeks of much more severe symptoms than a little poke that will last a couple of seconds. So that seconds or minutes with a pharmacist or a nurse could help to prevent further illness down the road. There's very few reasons why you should not receive one. In the past, there was concerns about individuals with allergies to eggs. Now we've been able to hone in on that science and make it more applicable or more available for people who do have allergies, that it's still okay for you to receive your flu shot. We can monitor you closely, make sure that you're not going to have a reaction to those vaccines. So I really do recommend that you seek that out. In addition, I've been receiving questions already from patients regarding the flu shot versus vaccine, COVID coverage. And we just want to be clear that the influenza virus is a different virus than the COVID virus. They're 2 different illnesses. Yes, they do affect the respiratory system. So with that, we want to try to boost our immunity, like what was just mentioned. We want to make sure we're as healthy as we can be. And the flu vaccine is going to be able to help give us tools to ensure that we are optimizing our health. If we have this tool available, I strongly urge that we seek it out and get it as soon as possible, because the common misconception is that we receive a flu vaccine and we're immediately protected from the flu. And that's not the case. It takes our body a little bit of time to build that immune response, typically about 2 weeks. So you might hear, I got my flu shot last year and I got sick, so I don't want to get this again. Well, there's a lot of reasons that that could have happened. It could have been that your immune response had not been built up yet. It could have been that maybe you did feel a little crummy after getting your flu vaccine because your immune response is starting to kick in. So your body's starting to fight off that little taste of the flu vaccine that we gave you. And so you might feel a little tired or a little weak, or you might feel a little bit of soreness in your glands after receiving the vaccine, but that should only last a day or so. It's transient, it's not something that's going to persist. So I really would recommend seeking out the flu vaccine as best as possible. Another question that I do receive is, well, if we're social distancing or wearing masks, why do I need to get the flu vaccine? And this I like to draw on my own personal experience. I'm Latino. I have grown up in a Latino home, and family is very important to us. And even with social distancing, we may be hanging out with our family a lot on weekends, or may be going to family gatherings. And we want to do our best to protect our grandparents, those in our family who may be pregnant, the babies in our family. And we want to use every tool we can to make sure that our family remains safe. If there's been any type of barriers for being able to receive these vaccines, maybe there's lack of insurance or there's lack of knowledge of where to find them, there's a lot of free flu shot clinics around. You can try looking online. You could go to we have them readily available here at RUHS at our numerous clinics that are located throughout the county. So whether you're in Palm Springs or Lake Elsinore or Temecula or Riverside or Corona, throughout the county we have them available, and you could get in touch with an eligibility specialist who can maybe help you figure out what's the best way to either get free vaccine or a low-cost vaccine, as well as healthcare. So with that, I just want to recognize that we are currently in National Hispanic Heritage Month, and with that, we have a lot of pride of the contributions that Latinos have given to our community and to our nation, but we need to focus on our health today so that we could continue to build on that legacy and continue to contribute to our society here. So with that, I'll turn it back over to Heather, and thank you so much.
Thank you, Dr. Williams. I now want to introduce from Behavioral Health, RUHS' very own Marcus Cannon. He's going to give the community some tips on stresses, on ways to cope during this pandemic. We understand that there's been information fatigue, there's been ups and downs, there's been opens and closes. So we want to make sure that everybody is well mentally as well as physically. Marcus?
Thank you, Heather. Good afternoon, everyone. I'm Marcus Cannon, an administrator with RUHS Behavioral Health. And like my colleagues before me, I just wanted to share with you a few tips about how you can optimize your health. We know that this has been a long year and a strange year, a year full of many trials already. And so, like Heather said, some people may have information fatigue. We may be feeling like we're already worn out, and now we're headed into a flu season and still continued COVID. So behavioral health, when we think about wellness, we think about taking care of the whole person. There's no one-size-fits-all approach. We need to think about our physical health, our biological, our emotional, our spiritual, our social, all those different domains. So first and foremost, like my colleague said, taking care of your physical health will help your mental health. Getting adequate rest, eating healthy food, exercising, taking prescribed medication, getting in to see your doctor, all those things are still important as always. When we think about our psychological health, I think stress is a good place to start. Stress, it's certainly something we can all connect with this year. And again, there's no blueprint. There's lots of ways you can help your stress, but one thing, given the state we're in currently, I would say is to think about your media consumption and your social media consumption. Seems like regardless of what side of the political spectrum you're on, whenever you turn on the TV these days, it's not good news. And so we would encourage people to monitor that intake and take breaks and set aside time to say, okay, I'm not going to be on the TV anymore, I'm not going to watch the news anymore. A similar stress management thing, I think for a lot of us, is to have a plan for what will I do if I do get sick. It can be common to get a cold or a flu during the winter months, and especially in a COVID year, we know that people, sometimes they have those first symptoms of cold or flu that my colleagues described, and they might immediately start to think the worst or to be fearful. So having a plan of what will I do and how will I manage my fears if I get sick, and what will be my plan for some of my basic needs. How will I provide for childcare if I need to be off my feet to rest for a few days? Planning ahead is great, but sometimes our brain can kind of run away with us and we spend all our time either worrying about the past or planning for the future. And so a tip that we would offer in those circumstances is something we call mindfulness. Mindfulness might sound complicated, but the good news is it's free. Anybody can do it anytime, anywhere. All mindfulness means is paying attention to the present moment and not thinking about the past or the future. You can do this sipping a cup of coffee, taking a walk and listening to the sound of your own breathing or your footsteps on the pavement, working in your garden, playing with a child. There's a million ways that you can practice mindfulness, and the science shows us that mindfulness helps reduce stress and increase resilience. Another important tip that I would share is gratitude. Like mindfulness, science shows that gratitude increases well-being. It increases our sense of wellness, and it decreases stress. Gratitude, again, can be practiced by anyone, anytime, anywhere. It's free. We can be grateful for small things, and we can be grateful for big things. Someone made the joke to me that he said that, you know, with COVID travel restrictions, my in-laws aren't going to be able to come and take over my house for a week, and that's what I'm grateful for. All joking aside, we know that, you know, this might be a strange year for travel plans, and so it is important to have connection and to be able to reach out to people, and we'd like to be able to help if we can help in that way. At the end of my talk, I'll share a couple ways you can get in touch with us. One more tip I would mention is that the holiday season is coming. It's natural many of us might like to have a drink over the holiday season, but we've already seen significantly increased alcohol consumption in the state of California this year. So it's important to keep an eye on that for yourselves or your loved ones and say, you know, if this is getting away from me, it's time to reach out and ask for some help, and we have resources for that. In terms of taking care of our social health, we've talked about that already. My colleague talked about, you know, backyard gatherings, family gatherings. We want to practice those safe measures to do those gatherings as safely as possible, and then to keep those digital skills sharp that we, thankfully, here in 2020 have learned how to stay in touch with family and friends from a distance and use Zoom and use Skype. So we think that's an important tool to not go through stress alone. And then lastly, we think about our spiritual health. We know that each of us believe different things, but all of us have things that we think are of highest value and that give our lives a sense of purpose. And one of the best ways to reconnect with that sense of purpose is looking for someone else to help. We know that reaching out and lending a hand to someone who's struggling can really reconnect ourselves to our own sense of purpose. It helps that person, and it helps take our mind off of our own stresses and fears in the process. So I'd love to conclude just by saying that if you or someone you know is going through something, please don't be afraid to reach out and ask for help. We've got lots of ways to get in touch with us. You can call us at 800-706-7500. That's our CARES line. You can ask for any services, mental health or substance use services there. If you like mobile platforms, you can hit us up in the chat at takemyhand.co. And if you want to search for resources and information, go to our website at rcdmh.org. Thanks so much. Stay safe and be well.
Thank you, Marcus. As you can see, here at RUHS, we care about every aspect of your health, from mental health to physical health. I know that now more than ever, it's important that you have all the information that you need to stay healthy and to stay well. So we hope that the information that you received here today was very helpful.